So the medical screening timeline can be few months, sometimes longer. So the medical records review, again, will take 2 to 4 weeks, depends on how many records there are, which is how many pregnancies there were. Sometimes we're missing documents, right? We start the review and we're like, oh, we don't have the delivery report for baby number 3. So then we have to wait till we get the missing documents. Again, sometimes we just can't get them at all because they don't exist. Once we've reviewed that, sometimes we see medical issues where we say, okay, we need you to add the intended parents to consult with a high-risk obstetrician. So that then will pause the medical record review because we need all involved parties to be educated as to what is this medical condition, what are the risks, what does this mean for us? So that then adds time because now you have to wait for your appointment for the high-risk obstetrician, et cetera. So sometimes it's a month of medical records review, and then we can schedule that in-person evaluation. But sometimes it's, oh gosh, 2 to 3 months of medical records review before we can move on to the in-person medical screening. And the in-person medical screening, ideally, we try to have the surrogate come when her lining is the thickest, which is usually the middle of her cycle, like cycle day 12, 13, 14. Sometimes that's not possible because the surrogate is taking birth control pills at the moment. And if that's the case, we just have her stand the birth control pill and we just have her come anyway. Sometimes we have surrogates who use the IUD, which is a great form of contraception. The problem is sometimes IUDs are so effective that they really thin the lining of the uterus, called the endometrium. So many times we will have her remove the IUD and have her wait 2 menstrual cycles for that lining to get fluffy again before we have her come in for medical evaluation, because we want her to come in just one time for that medical evaluation, and we want her to come in when that lining is as optimal as possible.